Kristen Shimra Mucho. So I think we can welcome the first panel, which is going to be moderated by, by the future pharmacist, Eric Nchizirungu. Please, you are welcome. A round of applause to him.
Okay, thank you very much. As she said, I'm Eric Nchizirungu. I'll be MC and the moderator at the same time. But before we start, I would like to apologize everyone, mostly the speakers, for the inconvenience of time. You know, we didn't plan this. So let me start with then I'm going to work as moderator before. Okay, we are going to be talking about an interesting session about Ncds and a lot of pharmacists to tackle this global burden of non-communicable diseases. On my panel, I will be with a very amazing panelist, including Otinier Nimbabazi. He is a pharmacist by profession, and he is currently pursuing master's degree in global health delivery. He has worked in different pharmaceutical supply chain and different public promotion projects. He's mainly interested in health research and innovation. My second speaker is Louis Grignon. Ngawonzima. He's a registered pharmacist and NCD advocate who is passionate about global health. He is the director of communication and he has contributed to advocacy effort of the Rwanda Non-Communicable Disease Alliance. Most recently, he has supported the Rwanda NCD Alliance in the development of Rwanda advocacy agenda for people living with NCDs. As part of our Views, Our Voice initiative designed to shed more light on meaningful involvement in NCD response. So we are having some problems. The people on Zoom are not ready. I mean, the system is not ready for the people on Zoom, and there are many compared to those who are attending physically. So it's better if we wait a very few minutes for them to adjust it. Okay, we can now start, and I'm very sorry again. I will repeat, just to make sure that the people online will get the same content as ours. So I've been saying that we are having two panelists, and the first one is Otinier Nimbabazi. He's a registered pharmacist, and he's currently pursuing his master's in global health delivery. He has worked in different pharmaceutical supply chain and different public promotion projects. He is mainly interested in health research and innovation. The second speaker is Louis Grignon Ngawonzima. He is a registered pharmacist and NCD advocate who is passionate about global health. He is the director of communication, and he has contributed to advocacy efforts of the Rwanda Non-Communicable Disease Alliance. Most recently, he has supported the Rwanda NCD Alliance in the development of Rwanda Advocacy Agenda of people living with NCDC as part of our Voice initiative designed to shed more light on meaningful involvement in NCD response. He provides strategic leadership in the development and the execution of a diverse range of organizational communication, both internally and externally as part of his daily duties. He has extensive experience in non-communicable disease advocacy and communication. He has served as RPSA president and IPSF contact person between 2019 and 2018-2019, and as the public health officer 2017-2019, and as the campaign coordinator 2016-2017. I think we can give them a round of applause. So, to make things very quick, I would like to give a very few minutes to Louis, for him as someone who is in NCD's alliance here in Rwanda, to give us the clear picture of NCDC here in Rwanda and globally. And after that, I will have my panelists here for our questions. Welcome, Mr. Louis.
Thank you so much, Moderator. Good morning, everyone. Thank you so much for the opportunity to walk you through the SAMU statistics to base on while talking about NCDs in Rwanda and also globally. Actually, I have only one slide which contains some important statistics that could be the base to warn us to act on NCDs. When we say NCDs, we say that there are a range of NCDs, but globally there are some meetings, there are some high-level meetings that state those people, high-profile people, I mean WHO, United Nations, that sat together and listed the big 4 NCDs, which are cardiovascular diseases, chronic respiratory diseases, cancers, and also diabetes. But for the recently concluded UN high-level meeting, they also added mental health illnesses as among the big NCDs. So now we can have that, we can say that we have 5 NCDs. There are some statistical findings that can warn us and also be the base to act on NCDs. Like those 4 NCDs and other family of neglected NCDs, they are responsible of 71% of total death globally. That means that cancer, diabetes, hypertension, stroke, injuries and disabilities, they are responsible for 71 total death globally. The bad thing is, among the total death globally, we have premature death. If we say premature death, we say it's a death that's happened at the age of 30, between 30 and 70. Another bad thing is, among those 45 million that's who dies globally due to NCDs, we have 85% of the premature deaths, they happen in the low and middle income countries where our country, Rwanda, is located. Other thing to know is that NCD, you can ask yourself if there is some specific groups that are vulnerable for NCDs. But I would like to answer the same question, like there is no specific group that are vulnerable for NCDs. NCD affect all people of all ages, from all regions, from all countries, from all the cultures, poor and rich. Also, you may ask yourself about risk factors for NCDs. We have what we call modifiable behavior risk factors of NCDs. You may know that one of them is an unhealthy diet. When we say unhealthy diet, it's a big group of some risk factors and some factors also. We may list like high level of fat intake. We may mention a high sugar and sugar product intake. Also, we have high fat intake. If we say fats, we can say cooking oils. We can say all those products resulting from oils. Also, there is another important thing we have to notice is that in order to have healthy diet, World Health Organization recommend that at your diet, your daily diet, at least you have to have 5 servings of fruits per day. Do you get it? You need to have at least 5 fruit serving per day. I don't know if among us there is some people who comply about this recommendation. Apart from unhealthy diet, we have also tobacco, smoking. We have alcohol. For the alcohol, with the recent publications, they say that there is no safe quantity of alcohol. So there is some misconception around alcohol, but we would like to declare that there is no safe quantity of alcohol. Also, we have insufficient physical activities as one of the risk factors for NCDs. For this, World Health Organization recommend that people, they should at least engage themselves in the physical activities at least 30 minutes per day. At least 30 minutes per day. I don't know if you comply about this with this recommendation, but also they say that some people may be engaged in different activities that may inhibit them to get engaged in the physical activities. But at least if you cannot manage to do 30 minutes per day of physical activities, at least you can do sports, you can do at least 150 minutes per week. I don't know if you can manage to do it. Those are 4 main behavioral risk factors for NCDs, but there is another risk factors that contribute to NCDs, especially for mental health, which is the quality of sleep. Do we have enough time for sleeping? Are we having enough rest? Also, the quality of sleep influences our mental health. That's why also the quality of sleep has been added to the list of NCDs factors. There is also socioeconomic impact that are linked to NCDs. I can list the 2 among them. One is poverty. NCD require a lifetime treatment. So people who suffer from NCDs, they find themselves experiencing out-of-pocket expenditures. Also, their family spend a lot of money for treatment care. Another thing is that those people who are living with NCDs, they are experiencing what we can call social disadvantage. In their community, they are not considered as normal people who can contribute to the advancement of their family and of the country at large. For the prevention of NCDs, I'm going to come to the end. About the prevention of NCDs, some people, they know that addressing NCDs is only limited for healthcare professionals. However, if you remember the risk factors that contribute to NCDs, you may identify other other actors that can contribute to the prevention and control of NCDs. It's very clear that to flatten the current trajectory of NCD epidemic, it is very crucial to promote the whole of the country and the whole of the society approach so as to make it effectively and efficiently. When we say whole of the country, we say that all the public institutions to work together to address to NCDs, whole the community. We say that the community-based organization, civil societies organization, and also the community at large, individuals, they need to work together to address NCDs. No single entity that can work to address NCDs efficiently and effectively in the country, at the family level, and the whole world. I think, according to the global commitment and the leadership, there is what we call the SDG Agenda. In their third article, they emphasize on the promotion of health and well-being. At the fourth article of the third article, there is where they highlight that the need for the global effort to match effort to address NCDs. So it's where the global target for reduction of NCDs, it is stated that the whole world needs to reduce 1/3 of premature deaths of NCDs by 1/3. That means that those million we've been mentioning, 71%, the world has the target to reduce that premature deaths of NCD resulting from NCDs to 1/3. You can calculate and see the global target in numbers. So that global commitment also demonstrates or it's clear shows that a lot of the pharmacists, it's crucial in addressing NCDs, especially when it comes to their expertise in medicine, information sharing, and also another important part of them, which is supply chain and logistics. So I can stop by this and continue with the other program.
Thank you, Mr. Rui. For now, we can proceed to the discussion, and I would like to call Mr. Tonel to step forward. Okay, thank you, Louis, for this insightful presentation, which include the real picture of how NCD is a global burden, and not only globally, but also it includes our country, Rwanda. So the magnitude of the problem and this lot of damage it causes, which include the premature death, and one of the most killers here in the world. Then today we are here discussing the lot of us as pharmacists, then to shed that light to combat or to tackle this killer here in Rwanda. So pharmacists are highly trained, and we all agree on it. But sometimes we are like underutilized to be on the lookout of those problems. Despite that we are trained, we are even accessible and easily accessible regarding the healthcare compared to the other healthcare systems, and mainly in emergency time like COVID and others, where people are not able to go to the hospitals. Then we'll be discussing a very small questions. This question goes to Louis. What is the role of pharmacists in the reduction of the global burden to NCDs?
Okay, thank you so much. Let's start addressing the questions by saying that there is no single pathway to addressing NCDs, as I said in my small presentation. Even a pharmacist in their respective area of practice, without a coordinated effort, we cannot address NCDs effectively. However, there is, I can categorize the question, the answer into 4 aspects. Like, we can see the role of the pharmacist in prevention, we can see the role of pharmacist in treatment, we can see the role of pharmacist in research, we can see the role of pharmacist in advocacy. Starting with awareness and learning from success stories from other countries, we identify that pharmacists have extensive role in raising awareness in the community. Like they are promoting public health. But here in Rwanda, I don't know if I don't have a successful stories for the pharmacists, unless those who are working in public health, like me and my brother, Confrere Otiniel, and others who are in the public health. But it's crucial that pharmacists join the community effort of civil society organization to raise awareness in the community. That's where they will play their role of dispensing adequate information to the community in regard to prevention and the control of NCDs. So that's one. Another thing we can say in the prevention, it's like they can contribute in NCD screening. Saying this, it was proven that, and we believe that knowledge is power when it comes to prevention. So it's something crucial for the pharmacists to get engaged in NCD screening activities. And when it comes to treatment, that's our area of focus when it comes to treatment. So we are medicine expert. That's where our role, and most of us, we are working on this aspect on daily basis, where we dispense medication. But we may ask ourselves, is it enough to dispense medication to patients? Is it enough? Or we may have an advanced role when it comes to treatment. So there is other things that may need to be addressed on this aspect of treatment, where a lot of the pharmacists should not be limited on dispensing medication. They can also contribute to follow-up of the patients. Why can we give medicine to patients and let them go without even remaining with their contact to ask if the treatment outcome has been achieved? It's also follow-up, patient follow-up is something that can pharmacists do for addressing NCDs. There is also one thing, which is the other thing, which is a drug interaction. I didn't mention it while I was presenting the small image of NCDs, but when one person is experiencing NCD, is having like hypertension, it's likely for him or her to develop another NCDs. They are interconnected. They are sharing the same risk factors. So it's up to the pharmacist to know medicine interaction. When some person is being treated with like diabetes and kidney and the hypertension, what the interaction of the medicine that are being dispensed to that patient, it's up to the pharmacist to recognize and know the drug-drug interaction. When it comes to research aspects, while addressing NCDs, also it's up to the pharmacist to plan and conduct clinical trials. This can go hand in hand with those new medicines and also existing medicines. From the research may lead to conducting evidence-based advocacy and also exploring further advocacy priorities. But we can do this with in mind that we do in the interest of the patient. So we can brainstorm about a lot of roles of the pharmacist in addressing NCD, but let me stop by this. Thank you.
Yeah, thank you. I think I was not the one to tell you to clap for him because he gave us a very insightful point. And it's very clear that our law is not limited to dispensing. As he mentioned it, we are also ready to promote the health and make sure the outcome of the patient to NCDs are very responsive. So I'm not going to make more comment on that because I know you got the point. Let me come to Otinier. So he mentioned different points, but to the pharmacist, work to the patient requires this total intervention, as he mentioned. Then what is the pharmacist work? To work with the patient and for the patient, then to address or to optimize the outcome for them to NCDs.
Thank you very much. First of all, I would like to congratulate RPSA for bringing again together. I think it has been 3 years without having such kind of interactions, and I think as we are getting back to new normal, this is the way to go, and congratulations to the team who has been reading this. Then talking about optimization of NCDs patients regarding to the medical therapy, their outcomes. As we know, NCDs are chronic diseases, so they spend most of the time having medications. So it's important that they have adequate care from pharmacists in order to have the required outcome. Because when there is no outcome to the medication, to the NCDs patients, they get different complications. Some of diabetes, some might get amputations, others they may lose their sight. All those, they come because there has not been adherence to the medications. That's why pharmacists has to play a big role regarding to the NCDs patients. Then in order to have that, first of all, it needs to start with the availability of medication and self-care tools, because we need glucometers, we need blood pressure, then also we need the medication, because one of the issues that we are facing in middle-income countries to have more than 85% of the premature death of global premature deaths from NCDs, because we lack medication, we lack the self-care tools. When we have the availability of those, our patients will be able to access those. And once they are having the adequate accessibility, now we'll be talking about the improvement of adherence that will come with the patient education and the caregivers education, so that they can understand how to take their medicines and how they should be adhering to it. Because when you fail on medication, you fail also on the diseases. Another thing is that NCDs patients, as we have mentioned, they are also vulnerable towards the polypharmacy. They tend to have more than one diseases, and also tend to have more medication. So it's for pharmacists to ensure that there's adequate prescription of the drugs, so that they take the required drugs, and also to have the required outcomes. Mainly those, how I can say that pharmacists have a big role in this of challenge of NCDs, mainly regarding to the optimization of the outcomes for the medical therapy. Thank you.
Thank you. I think he deserves a round of applause. Okay, thank you also for this great insight. As we mentioned before, those people are getting a long life treatment, which requires a total adherence for them to optimize the result of the therapy. So, as he mentioned, you have to make sure that all that he said are available, and we are the one who are implementing it so that the patient are not going to get under therapy because we are not working properly. So let us proceed, due to the shortage of time, to the next question to Mr. Rui. You've mentioned promoting public health, and it's accurate that it requires the intervention of different health sectors, not only pharmacists. So what are the innovative approaches for the pharmacist to maximize a highly safe, accessible and affordable primary health care in the response to the prevention of NCDs?
Thank you so much. I've been following yesterday's presentation, and I've had a lot of presenters saying that a pharmacist is the most accessible primary health care professional. And I'm with it, I'm with the statement. So when it comes to prevention, first of all, the pharmacist should be recognized. We know that we are the most accessible healthcare professionals, but when it comes to political landscape, we find that pharmacists are not recognized as key players for public health. When it comes to response to pandemics, epidemics, the role of pharmacists, they used to be, I cannot say that they are not considered, but they are limited somehow. However, the pharmacist should be at the center. I've said that for the global commitment of SDG 2030, they centered the pharmacist as one of the key players to achieving the SDGs. So at national level, pharmacists should be recognized as the key players for public health. So there is this of being recognized, but also the pharmacists need to be trained. They need to be trained. I don't know if it can be an organized training or personal commitment training, but they need to be trained so that if they inquire from them some support, they are ready to deliver. I'm saying this because, if I may say, for COVID response, we've been seeing that some pharmacists were not, a lot of the pharmacists has been undervalued. So, coming back to the prevention of NCDs, there are some innovative approaches that may be employed at either pharmacy premises or also for personal commitment that can lead to effective prevention of NCDs. Starting with at the pharmacy premise, and in accordance to the theme of this symposium, we are moving from basics to modern practices. So recently, with the advancing technological aspect, either from here in Rwanda or globally, we are seeing that we are trying to maximize the opportunity. We are leveraging the role of media, and also we are trying to use available spaces for disseminating information. I say that for the prevention aspect, knowledge is power. You cannot prevent something that you don't know. It's critical to be aware of NCD ahead of contributing to the prevention. Here, among the other innovative approach that can be employed by pharmacists, I know we used to work with one of the university from England while we were addressing antimicrobial resistance. We were designing some infographics to be placed in the pharmacies, where patients came to take their medication. They are able to read like to be able to see some education apart from focusing on medicine. They are able to read from something that is being hung on the wall of the pharmacy. So from there we can have like programs in the pharmacy that are detailing or describing risk factors for NCDs. It's something that is affordable, pharmacy can do. Another thing is leveraging the power of media. We know, I was talking to a confrere, Dr. Eric. They are emerging information, misleading information in the media, circulating in the media. You all know that there are people who are saying that NCDs, they are curing NCDs. They are having medicine for diabetes. They are having medicine for hypertension. They are having medication for cancers. But according to our practice, the current practice, we don't have any success story where someone completely recovered from any NCD. Unless for cancers, when detected early, they are able to it's not even to cure, because after some time without taking care of yourself, it will regenerate. It comes again. So we can leverage the power of media to address those misconceptions around NCDs. And also there is another thing I liked from one of the pharmacy, which is Afia Pharmacy. They are using Instagram, they are using Facebook, they are using their website. So as when a patient navigates through the website or social media platform, they are able to reach the adequate information provided by a pharmacist from Afia Pharmacy. Why can't we pharmacists learn from that successful story from Afia Pharmacy to establish a website, a pharmacy-based website, to dispense the information through website? If we are not able to write books and books, why can't we leverage the power of media? So that's some innovative approach that can be employed by pharmacists in order to prevent NCDs. Thank you.
Thank you very much. I think he deserves. Okay, before I proceed, I think we are getting more clear about this, and you guys, you are getting more information on this. Because we are moving in the world that requires to be more innovative, as he said, and not only that, but we go with the technology and other projects that are coming as days comes. So we as pharmacists, all these things that he has been saying are necessarily required for us to maximize what we are intended to do. Not just to go there and give someone nifedipine without this follow-up of knowing what that nifedipine has done to the patient. So I hope this is not only for the symposium, but you guys, we are making up some ideas to implement. Isn't it? Okay, so let us proceed to the second question to Mr. Otinier. You've listed that people with NCDs are subjected to polypharmacy, but also there are other factors. Yesterday they have been talking about technologies. And when it comes to technologies, there is no interaction, direct interaction with the patient. And from the school, they taught us that we have to give the patient some medication. We are not selling pins. This is what most of our lecturers say. And I have this question. What is the critical role of patient pharmacy-based education to the patient in response for these NCDs? Because they are exposed to several factors. And it's clear that they need this intervention of education in the pharmacy. So what is that role pharmacists have? Education in the pharmacy for the response of the outcome of NCDs based on all these factors that I've listed?
Okay, thank you very much. First of all, I think patient education or community education is not only for pharmacists, but what makes it particular to pharmacists is that, as it has been mentioned, is that pharmacists are the most accessible primary healthcare professionals. That's why pharmacists need to be on the forefront on patient education, mainly the ones with NCDs. In general, with that, is that pharmacists have information, and giving information to patients is one of the good pharmacy practice. And most of the time, for those who have been community pharmacists, sometimes patients come to the pharmacy just to ask information about their complaint they're having. And when you manage to give them the right information, you refer them to the hospital so that they can get more tests. And sometimes they come back, tell you that they have got some diagnosis, maybe NCDs or other diseases. That's why we need to work hard so that we can have everyone be informed on their complaints, not only when they are sick or not only they are having diseases, but also for prevention. That's why we need to take part in prevention measures, communication, be in different platforms. We can have this symposium, we can have media, we can also write different articles on how we can prevent different diseases, particularly NCDs as we are discussing today. Another thing the pharmacist has to play is that we need to recognize that. We need also to position us as the most accessible healthcare professionals, because many people in the community, they don't know that. So if we position ourselves, many people will come. Some they come because they are not near a health center, they're not near a clinic, but if they understand that pharmacist is the right person to get the health information about, they will come. And maybe we still also have different gaps in policies where they're remitting some of the services from the pharmacy. But I think when we be able to have maybe some of the basic screening at the pharmacy level, it will be easy for patients to get all the information. Because if you can be able to have blood glucose screening, maybe blood pressure screening, it will be able to help people to get most of the information from us, and also we can refer them to hospital for further diagnosis. I think that's basically what we need to do so that we can be able to involve as much as we can in patient education and prevention of NCDs as pharmacists. Thank you.
Thank you so much. I think you deserve. I know I'm having a lot of questions to ask them, but I know you two have some questions, but due to time, I'm going to give the floor to you to ask those questions. For everyone who has been here since yesterday, I know that you've noticed that everything the speaker are saying is based, comes to us as the pharmacists to take the first action. To actively participate and involve in all these decisions that we need for the best quality of the therapy that we give to the patient. So you guys, for those who have questions, I would like the ushers to give the microphone and you raise your hand and then ask the question. If you have any question, please, I'm taking 2 or 3 and then, okay. First, Prof, have one. Can you guys give the microphone to him?
Thank you for your presentation. I'm happy that there are pharmacists who are leading different activities, campaigns, and events to fight against NCDs. I always see you on social medias and your colleagues. I have one question. You know, this time we are facing COVID-19, and according to reports, they suggest that the COVID-19 affect blood vessels and can be a risk factor for cardiovascular diseases in long term. So I wonder if, as NCD Alliance, you are considering this issue. Maybe you may assess the long-term outcome of COVID-19 on cardiovascular diseases and the other Ncds, because it also affect metabolic functions and can lead to metabolic disorders and so on. So I want to hear from you your contribution toward this issue. Thank you.
We are having 3 questions, and then they will answer.
Okay, thank you. I just want to ask Pharmacist Louis about NCD Alliance. Like someone who are in NCD Alliance, can you have you have given us the global statistics about NCDs globally. Can you have some statistics in Rwanda, and when you evaluate what NCD Alliance has been doing since it started, do you see that there is a progress you are making by decreasing NCDs? And what are your future plans? And what are recommendations you may ask us as a pharmacist or anyone else who are involved to combat these NCDs? Thank you.
Anyone else with a question? You can raise your hand.
Thank you very much. My name is Regis Ramanda, and I have a question. You said the pharmacists are the most accessible healthcare professionals, and you said we need trainings so that to combat the NCDs. So, like NCD Alliance, what are you preparing for pharmacists in terms of these trainings or the efforts to train pharmacists to combat the NCDs? Thank you.
Thank you. I think we can give the floor to the speakers to answer the question. Mr. Louis can proceed.
Let me start addressing a question from Nyanugui, but Otine will help me. You know, we've been addressing challenges caused by COVID-19, and we at Rwanda NCDs Alliance, we are working in a different aspect while addressing on NCDs. That includes prevention, control, research and advocacy, as I said. So, for the research aspect, we are still collecting information, and we didn't come up with a certain topic to work on in respect to COVID-19, but it's something to do. It's something to do. We were not aware about this aspect when it comes to NCDs inducing cardiovascular diseases. So it's something I noted, and we work together to address it. I don't know if my colleague Otinil has something to add. Hasn't. Addressing the second question from the President, asking about the national status of NCDs. Actually, the important information to note is that at the national level, NCD claim 59% of the total death in the country. I think that should be the base. I don't know if it's enough for you, but it's a common statistic to share with you. NCDs claim 59% of the total death. And especially here in Rwanda, we are having a lot of contribution from injuries and disabilities. So that's something that has been added, apart from death from diabetes, cardiovascular diseases, cancers, and chronic respiratory diseases. We have our uniqueness here in Rwanda of adding injury and disabilities. They are contributing to the total death in the country, 59%. The second question, it's very hard to address. You are asking if what we are doing, we are really measuring the impact that is bringing the country. I can say that we didn't measure the impact, but we started, because we knew before establishing One Ncds Alliance, we knew that prevention is better than cure, and we may even focus on prevention other than focusing on measuring the impact. I'm saying this because we based on the national statistics of NCDs. So we decided to put much effort in the prevention. So now we can say that we have this and this in place so that we can start assessing the impact of what we started. We started working on prevention. We are working on treatment, but how can we quantify the impact of our intervention? So we are going, it's a trajectory. We are somewhere on a trajectory, but the future will be able to assess the impact of our intervention in the country. Legis asked about what we as Rwanda Ncds Alliance is doing to train pharmacists. It's something that I mentioned early, that pharmacists are missing some skills when it comes to addressing NCDs, especially basing on what we are acquiring from university. But you all know that RPSA is one of the founding members of Rwanda Ncds Alliance. So we are working with student organization. Many of you have been trained for screening. You are participating in the Car Free Day in Kigali. You are participating in the Huye Car Free Day. That's where we were able to start. We started with students. But also, for the good collaboration with the pharmacy, we are working with Komera Pharmacy. It's soon to start with them. The collaboration will also include capacity building of the pharmacist, so that's what I can say. For the training, we are mostly working with student organization and also exploring some partnership and collaboration with pharmacy and other institutions to make sure that pharmacy are trained, are well equipped with those skills required for addressing NCDs.
Thank you. I think it deserves some round of applause. Okay, I think this is the end of our panel. Due to the time, and I want to thank my panelists, Mr. Otoniel and Gabo, and of course, amazing audience like you. We've had, you have something to add?
Before leaving the panel, yes. I cannot leave the panel without saying that we will not have the right time to work on NCDs. It will never come. So the right time to work on NCDs, it's now. Let's start acting now.
Okay, I think it's better I can address this to the RPSA leaders, that we have more discussion like this so as to get more insight on what we have to do. And you can see that we have a lot of gap. The education or the modules we are getting at the university is not actually going to address a lot of questions that we have here outside. So we need more of this so as to get this knowledge and skills and insight for the future of an effective and good quality of the therapy that we want to deliver to the patient outside. So thank you, panelists, and thank you for kind attention. God bless you. Actually, I'm working as a MC2. Am I going to thank you to the moderator? Okay. Am I going to say thank you to the moderator or the speakers? Okay.
I would say it. So thank you very much. Thank you for the speakers, and thank you so much for the moderator. It was very impressive, and I hope we learn. We are here to learn so as to be able to have sufficient knowledge, sufficient skills, to be competent, so as we can move from basic competence to modern practices. And actually, when they were saying about some innovations that can be brought in NCDs, one of the things that I saw when I was working, doing my interns at the hospital, there is inaccessibility of information to patients. So when we are able to use technology so that the patient can access information in the right way, that could decrease the challenge that NCD patients need. So thank you very much for the information that you give. We are going to the next panel before the lunch. And this also will be very impressive. So what's the next panel?
Okay. Everything that we got here was amazing. And we are proceeding to the next panel. And I would like the moderator to introduce you the speakers. But I'll talk about the topic. The topic is about leadership and change management for pharmacy professionals. Pharmacists, we are readers, and we are moving from basic to modern. So we need to update our knowledge as readers and our capabilities to handle all this outside situation. So welcome, Moderator Mutoni Ange.
Mutoni Ange, Mutoni Ange has been very supportive to RPSA. We are very glad that you are here today with us. You are welcome.
Good afternoon, everyone. Good afternoon, everyone. Well, I don't know why we are so shy. I don't know why we're so silent. But I would like us, first of all, to be, engaging, because we're going to have a very interactive session. So it won't be amazing if I am having people who are this shy, who are this, uncommunicative. So please, good afternoon. All right. I don't see the vibe. I don't feel the vibe yet. That's why I'm going to continue to actually ask you, good afternoon. All right, so people who are sitting behind, with my humble, I'm asking you kindly maybe to join the front seats for us to, interact. Mainly, if you are having any conversation, it will be easy for me to tell the person to reach out to you when you're sitting in front seats rather than when you're sitting behind. So without the people who are doing the ushering, and the protocol. Others, please, we ask you to move in these front seats. And that would be actually also good for the people who are taking pictures, for them to look good and everything. So thank you so much for the MCs. My name is Ange Omotoni, like they said. You will excuse my voice because I had flu. We're going to discuss on the topic that they already stated. It says that leadership and change management for the pharmacy profession. I'm going to have very qualified and very interesting speakers. One will be online and another one will be here physically with me. Allow me to welcome Dr. Modifiable Eric to occupy the front seats here on the stage. A very big round of applause, please. Another one is going to be a pharmacist, Wase Ange-Marie. Ange, are you online? Can you hear us? Ange-Marie? If you may unmute yourself and maybe say hi for us to confirm that you're with us. All right, maybe she is still facing some technical. These techie instruments are not ours, so we do not manage them fully. So you would excuse us with any inconvenience. So I think I should sit there as well. Thank you so much. Welcome, Dr. Modifiable. So, yeah, I will start with you. If the people who are in technical team can please give us another microphone. Yes, if you may please take us through your bio. As I said, I'm very much honored big time to moderate this panel. And I don't even think that I should open one of these panelists' shoes, so I couldn't even manage to go through their bios. So I'd like to ask them to introduce themselves, and please make sure you tell all your qualifications to the people following. Yeah.
Will I start or I start? Okay. Good afternoon. Before starting my introduction, I should congratulate the RPSA for organizing such a big event. It is very good. And everything has a starting point, you know. And I know it is not the first, it is the 11th. So keep going on and keep improving. Keep engaging more professionals, not only pharmacists. Keep bringing in other professionals so that they can hear what you are able to do and where you're heading to, you know. It is very important. My name is Eric. I'm a Rwandese and a pharmacist. I graduated from the former National University of Rwanda, not UR. And I worked in the hospital, district hospital, Nyamata district hospital, and then I left it and I went to Rwanda Standard Board, the current one. Before it was Rwanda, RSB, Rwanda Standard, now it's Rwanda Standard Board, but I forgot the former name. So at that time I was working as a quality inspector, and then I went for masters. I did drug analysis from 2011 to 2014. I came back and I returned to my job. They moved me from the inspection to the lab, where I was a quality inspector officer. And then after that I went again for further studies. I did my PhD in pharmacology and physiology. So when I came back, I joined the university as a visiting lecturer. I can see a lot of people here, they were my students, level 4, the current level 4 students. I taught them clinical pharmacology. And after that, from last year, May, yes, to now, I'm working in Rwanda FDA, and I'm the division manager for human medicine, assessment and registration. And I know that some of the students that are doing internship are passing there, and I met most of them, isn't it? So that is, in short, my intro. Thank you.
Thank you so much. Like I said before, you can feel me. Really, I couldn't really even talk about the qualification of Dr. Migabo. Thank you so much. We are very humbled to be with you on this panel. I'm not sure if the people from the technical team, if you managed to have Ange, she's asking actually to be admitted. People in online managing the Zoom, if you may please admit Ange. But thank you. We will proceed, and then, like I said, technology is not something we can manage fully. It sometimes challenges us, but we will copy with it. And please notify me once Ange comes in the room. Dr. Migabo, you said more of your bio, and we also have this topic here. When I read this topic, personally, I am very passionate about leadership, and whenever a change happens, I expect a leader to act. So I'm very passionate, and I'm very glad that I got this opportunity to moderate this panel specifically. So when we say change management in the profession, what do you define it?
Thank you for the question. You know, we are living in a world which changes every day. If I call confrère Maurice, when you join the university, you are learning in French or English? In French. So now most of your courses are taught in French or in English?
English.
Yes. So when I was in the university, 80% of our courses, our classes, were taught in French. And I remember that in our council, pharmacy council, when we have such kind of conferences, events, most of the conferences are held in English. And most of the professionals, pharmacists, I don't know the statistics now, but most of them, they have French background. So imagine if you organize a conference and then you do everything in English. So most of them will be out of the scope. They will not follow you as you wish. So what I'm trying to say here is that we always face changes. So what we need to do is to manage how to cope, how to live with those changes, you know. Before we were not having any council. So we were just doing anything without a council bringing us together, you know. So when the council came, it was a change. So we had to manage, we had to cope, we had to follow, you know. So that's why we need to talk about change management. So we always have changes. Changes will always be there. I was saying that changes will be always there. So what we need to do is that we need to know how to adapt ourselves. I remember there is an event that was organized by our council. So you excuse me, I will say in practical, I like to say practical things instead of theories, you know. So we bear with me. I believe that practical things will help us instead of talking theories and theories and theories. In that event that was organized by our council, they were saying that in the future, there is a plan that if you didn't do biology and chemistry in secondary school, high school, and have a minimum of C grade, you cannot do medicine or pharmacy in the future. So before, I have an experience. Some years back, I met a Burundian. She did literature, lettres, in high school in Burundi, and she wanted to do pharmacy in Rwanda. She had enough money, and she wanted to do pharmacy. No, she wanted to do medicine. She came and she wanted to be admitted and research. And our university said, if you did languages, we cannot admit you in medicine. She was sad. And then after that, she went abroad and she did medicine. She's a medical doctor now. And when we met, she told me, Abanyarwanda muri rata, murishimye. So changes will always be there. Now she's a medical doctor practicing, treating people. But she can't be admitted in Rwanda or doing medicine or pharmacy. Changes will be always there, but you need to know how to cope, to live with those changes and to adapt yourself. So what you need to do in order to manage changes, I wanted to intervene on these points, addressing this question after someone answered about leadership. Because changes, they are brought by leaders most of the time. And most of the time, leaders, they set change and then they put in place some strategy to implement those changes and to manage how these changes are implemented. But because no one talked about the leadership, maybe I can talk a little bit about leadership.
Or maybe Ange can go first, because she's already online.
Okay.
All right. Thank you so much. Ange, are you with us now? Can you hear me? Hello, Ange. If you may unmute yourself and take us through your bio and introduce again yourself, please. I can see you online.
Yes, I can hear you now.
All right. Thank you so much.
Yes, I can.
We're very glad to have you now, Ange.
Hello, good afternoon.
Okay. Yes, please go ahead.
Maybe.
Thank you. Good afternoon, everyone. I'm Marie-Ange Roissy, as Ange Motel has said, and I'm glad to be part of this session talking about leadership. Can you hear me?
Yes, we can.
Okay, thank you. So I'm a pharmacist by education, and I'm currently working at Rwanda FDA as the Drug Products Information, Promotion, and Advertising Specialist. I have diverse background in NGO, humanitarian, I have worked with the Vision Foundation as the National Coordination Representative in primary healthcare services provision in Rwanda. And I have also worked as the director of the Center for Health and Rights at Health Development Initiative. So with this diverse background in NGO, in oncology, in global health, in public health, I'm now as a regulator at Rwanda FDA. Thank you.
All right, thank you so much, Ange. We were here with Dr. Migabo. He was trying to take us through what is change management and how do we manage changes in the profession. But it is better if you first define what is the leadership. When we say leadership in the profession, what do we mean? And in terms of the structures and roles, and even what is the mandate of that leadership. So now if you can go ahead and tell us more about that for him to come back after. Thank you. Ange, you're muted.
Ange, can you unmute yourself?
Ange, you're muted. We can't hear you.
Okay, can you hear me now?
Loud and clear.
Sorry, I was muted. So I was saying that leadership for me is a huge thing. So leadership being the seventh pillar of pharmacy profession. I think I'm muted. Can you hear me?
Now we can hear you loud and clear.
Can I continue?
Please go ahead.
I'm not muted, maybe it's internet connection issues. So for me, leadership, I was saying that it's a huge thing. Being the art of motivating people through the social influence towards achieving a common goal. Leadership is also a seventh star, the pharmaceutical profession, that comes before researcher. So a pharmacist should be a researcher, but also a leader. In every aspect of pharmacy profession, leadership should guide all our attitudes. Leadership should guide every step that we take on as pharmacists or pharmacy students. Leadership also, as you have asked about the structure of the leadership and their role, we don't have any specific leadership structure, but at organizational level, through the structure of the organization, we should have leadership. This means that we should have a well-coordinated effort of having people working together towards achieving a common goal, but also having different levels of management that can have people achieve that common goal. So also as the mandate of leadership, a good leader should be able to be flexible when it comes to management, when it comes to working with people. I think there are different attitudes or values that can guide the different qualities of a good leader. Among that, there is communication. A leader should be a good communicator. Communication comes also as a separate star of pharmacy profession. So when you are a good communicator, you are flexible, you have this active listening. You don't have to impose people doing things. You don't have to, tell people they have to do. So that's the characteristic of a good leader. You let people show what they are capable of. It's totally different from a good manager, because a good manager will always tell you to do what you're supposed to do, but not what you want to do. But a good leader will always tell you what you can do. And most of the time, we realize that we were not able to do that unless you were motivated by that leader of yours. So when it comes to leadership, also going through the aspect of education, going through the aspect of practice now, coming from pharmacy students to a pharmacist. As pharmacy students, we are exposed somehow to different leadership platforms that most of us will ignored when we were at the chair in the school. So RPSA, for instance, is a very, very nice platform of showing how people can become good leaders. I have passed through that channel of leadership. I have worked hand in hand with RPSA members. I have been part of the National Pharmaceutical Students Federation, which is a global federation that gathers pharmacy students that provide a very nice platform for pharmacy students to learn, to share experiences, share cultures, and all this has guided me into becoming of a good leader. I cannot say that I'm a good leader, good leader, but at least at the level where I am, I can see that RPSA has shaped me, has nurtured me into a very nice leader. IPSF has shaped me, has nurtured me into a nice leader. There's this also, when it comes to practice, most of the pharmacy students, when they start now working after school, they realize that they don't have anything to put on their CV. They don't know how to conduct themselves when it comes to interview, when they are asking them about their leadership skills or their the leadership role that I have taken, because at that time they were students. But RPSA and IPSF, they are very, very nice platforms to guide all pharmacy students. And if they use all the tangible things that are IPSF or RPSA, they will be able to know what to do, to know how they can be led into the interview by what experiences that they have heard when they were in RPSA or IPSF. Let me give you an example. When I was a student at the University of Rwanda, because that's where I got my bachelor's degree in pharmacy, we were organizing the African Pharmaceutical Symposium, and RPSA was leading to host the fourth one. So at that time, I didn't know anything about IPSF, but I was enthusiastic to learn more about IPSF. And I got nominated on the position of the chairperson of the fourth African Pharmaceutical Symposium. Till now, that symposium is still the first to have actually gathered more people, because we gathered more than 300 participants in Rwanda. And this also connected it with what we have learned or what we have been going through at RPSA, different campaigns that we have been conducting. I didn't even have huge experiences, but the way you define the little things you have done when you were still at school, this also helps you to know how you can nurture yourself into a good leader, or how you can define yourself as a leader. So briefly, that's what I can talk about leadership. I look forward to more questions or to more challenges during this session. Thank you.
All right, thank you so much, Ange. That was really insightful. Thank you so much for defining clearly who is a good leader and the characteristics of a good leader, and how a good pharmacist should be also characterized by the characteristics of the good leader. As we are pharmacists, we also need to be good leaders, because our professional has to be characterized by leadership skills. Thank Thank you so much. That was really insightful, and we do not have any doubt into your leadership skills because we've been raised under your feet. So we are very good testimonials for how good leader you are. So we appreciate having you today, and we are really eager to learn more about how your journey is. So back to you, Dr. Nyirimigabo. Now that we understand how the leadership in pharmacy professional is, I will give an example. Like, for example, we do have leadership structures like NPC or Rwanda FDA or RCPU, different structures. Whenever we have a change in the leadership structures, how do we have to adopt on those leadership? Maybe if we even have a minister who used to be a pharmacist, and maybe that minister is not having the next mandate. So that means we're going to have a next minister who is having other instruction on how professionals should be like. So how should we be able to adapt on that change, and what should we do as a pharmacist?
Thank you. Thank you for the good question, and I'd like to thank Ange for her presentation. So before I go to your question, let me come back to what he said, highlight some key points that I would like to touch on before I go to your question. So she said that a leader is someone who guides. He's a researcher. A guide is someone who can show you the way to pass, the way to go through until you reach your destination. And he's a researcher. He's someone who can do a research. A researcher is someone who can easily identify a problem and set ways of addressing those problems until he reaches his target, his objective. So that really the good point that she mentioned, that's a good point for a good leader. So coming back to the leadership, either on the organization structures or any other kind of leadership, a leader with someone who has a plan of where he wants to take the organization, a pathway from the starting point to the end point. So before reaching the end point, you have to set the plan and the activities that we do to reach your destination. So coming back to our profession, as we say that there are always some changes, as you said, in the organization, we need to adapt ourselves. So, but before we adapt ourselves, all the adaptation that we need to put in place will depend on the changes that came. So, the changes will be brought by the leadership, and the leadership had to set some strategies and to be able to make those changes. And then you cannot set strategies without having a good organization of yourself. You need to organize yourself. And when you organize yourself, and as Anne said also, you need to have motivated people. You need to motivate them so that that change is able to be adapted. People will follow the changes, will be easily adapt to those changes. And you need to build a teamwork, and then sometimes when you engage people, people may challenge you. And then most of the challenges will be positive challenges. You'll be able to be flexible, and you remember Ange also talked about flexibility. So those challenges, those inputs brought by teamwork will help you to improve. So we need to put in all of those aspects together to bring those changes into your organization. So coming back to members working with those leaders, to be able to cope, to manage those changes, a quality that we need, a skill that we need is to be flexible. We need to work on our attitude to be able to cope with those changes brought by the leaders, the leadership. So that's what I can say for the moment. Thank you.
Thank you so much, Doctor. That was really accurate on a question that has been asked. Before going back to Ange again, as far as I would like this panel to be very participatory, as you can see, we are with our leaders, Dr. Nyangi, and also our HOD, Head of Department. I would love also to have their insights on leadership. But before I go to them, and also the audience, I would love you to have your contributions and opinions on what you think should be done in our profession to improve the leadership. So now back to you, Ange. The question that I want to ask you now, it's more of the technicalities, the education system and the practice of the profession. What do you think should be done to shape the future leaders or the leaders of today more into education and also in the practicing? What do you think there are the gaps and what should be done? And I would
excuse me, Ange, would you please come again? Would you please ask again that question? I didn't hear it very well. There was internet connection.
All right. The question was, what do you think are the gaps into our systems to shape the young leaders who are just growing up into the profession in terms of education and also in the practice? What do you think should be maybe the innovation in the system we already have now? And how do you think they should be provided the spaces for young people to grow in terms of leadership, to grow their leadership? Maybe giving an example like the workshops or capacity building workshops. What do you think should be done in the profession to grow the young leaders who are now into the profession?
Okay, thank you so much. Ange, with that question, do you want me to go to prison after saying all the gaps that exist? Okay, so let's say that, to be honest, we have a lot of opportunities as pharmacy students. First of all, we have, our lecturers, they are well educated and they have a decent attitude of guiding young people. And after all what we have learned at school, with their experiences and their guidance, I think we have a lot to learn from so that we can be successful leaders to different domains or techniques of life. As I said, first of all, at the RPSA level or also IPSF level, we have different opportunities for young people. If we don't experience or we don't get exposed to things, let's say like manufacturing in Rwanda, we can be exposed to manufacturing in another country next to IPSF. We can get exposed, let's say, to clinical oncology through IPSF. Let me give you an example. In 2014, when I was still a student, I was much interested into oncology. And at that time, I can say that oncology in Rwanda was not welcoming pharmacists or pharmacy students to have that experience. Yet at school, we heard experiences from our lecturers. They taught us about oncology, oncopharmacy, but we were not really exposed towards that. So through IPSF, I participated in the student research program, where I had the chance to go to Egypt. I was interning in a hospital for almost 2 months. I was highly exposed to oncopharmacy, and I saw what pharmacists can do in terms of oncology. And I saw pharmacists making decisions. I saw pharmacists leading medical doctors. I saw pharmacists leading nurses, leading people engaged into laboratory or at different levels of the hospital working. So this really shaped me, and this showed me that, even pharmacists can do oncology. Even pharmacists can lead. Even pharmacists can lead medical doctors. Yet, I heard this from my lecturers, You have talked about Nyari, you have talked about the HOD of France, Dr. Francois. But I didn't see what they were talking to me. I just heard, but I couldn't see it. So through RPSA experience, I was now able to see what they were talking about. Now coming back to those who cannot travel due to different challenges or due to different reasons, we still have opportunities in Rwanda. We can still explore them. And someone has told me that, you know, for you to be a successful leader, you don't need to sit and wait for things to come to you. You just have to stand up, go and seek for opportunities. Through networking, through being informed, through determination, knowing what you want, knowing what you need, at which level that you need it, and through discipline, because a good leader should also have a discipline, you can get an opportunity and you can benefit from that opportunity. Now, at the initial practice, what can we do? We have a lot of pharmacists now working at the level of World Health Organization, working at manufacturing level, working at hospital level, working at different levels, business, you know, but how do we approach them to learn from what they do? And how they also approach us, pharmacy students, to learn from them. You know, the learning process should be reciprocal. As a pharmacist, you still have a lot to learn from pharmacy students to show you the gap that need to be addressed. But also as a pharmacy student, you still need to learn from a pharmacist who is ahead of you to know what is waiting for you after the school. So that's really what I can say about having leadership into practice, into pharmacy profession. It's all about networking. Without networking, you can sit and end up not getting any opportunity or end up not having any, you know, tangible thing that can help you through the process, through the pharmacy profession as a process or as a journey. Really networking, get informed, discipline, having discipline and the determination. You can know what you want, you can get what you want, and you can become a good leader into that big company. Or what? And again, when we were at school, we were not exposed to manufacturing of medical products. But now we have interest. We have seen that the interest of some industries that they want to come to Rwanda and start manufacturing and making something. In few years to come, then we be the ones as pharmacy students or pharmacy students joining into those manufacturing companies, and also to be us to work into those manufacturing companies. Now, how can we start the connection? How can we start the networking at an early stage? I don't have a special tip for that, but you can start, you know, networking. You can, I know this industry will come to work. Start learning a little thing about that industry that is coming to work. Start knowing who is engaged into this, who is working on that. You know, just try to find a way you can get a connection and get opportunities from.
Thank you so much, Ange. You really highlighted where, as young pharmacists who are now growing into the profession, what we need to do for us to grow into the leadership skills that we need for us to be great pharmacists for the future. Now back to you, Eric. I know you need to react on this. Please go ahead.
Yeah, I totally agree with what Ange said. And I want to say that the foundation is there. I want to call the attention of Conseil Françoise. Some years back, the department was in the Faculty of Sciences. So that time we could have, you know, there are courses that we share with medical students. But that time, because we are in different faculties, we are obliged to be taught by 2 different lecturers for the same course. So what I got the opportunity is that we are not even recognized as health professionals, because we are scientists in those labs in the Faculty of Science, but later we moved from the Faculty of Science to the Faculty of Medicine. And I learned that we even have some classes where we are in the same class taught by one lecturer. So let me give you something that may help. Maybe you started doing that, but it is something that you need to do consistently. You are in the same class, challenge them, show that you are able. I mean, you have the capabilities of doing the same thing that they are doing. Remember, everything that is done in our career in the pharmacy profession, we start from the decision of the policymakers. So if we cannot reach that position as a decision maker level, at the decision making level, we cannot influence the changes that we need. So it starts from the university, from the school table there, when you share with your colleague. So you are sitting with a medical doctor in class, studying, challenge them, like, talk together. That's what she called the networking. And then when MedSal have events, join them, participate, give your inputs, comment, show your capabilities. And then maybe those colleagues of yours, they are the ones who will be the ministers of health. So when they saw your capabilities from the school, maybe they will ask your ideas, your thought, and then those contributions, those input that we give, those advices that we give, they are the ones that will bring the changes that we need. You understand? I remember like 10 years ago, I didn't hear any pharmacist working in Ncds issues or NGOs, few, WHO, nothing else, MSH, USAID, but now, HDI has pharmacists and many more. So it's up to us to show what you are able to do so that others may bring us to bring our contribution to the community. Thanks.
Thank you so much. He highlighted that the foundation is there. We have the foundation. Now it's up to us as young leaders who are growing up to challenge the system, to challenge the positions for us to see the change that we need to see. Now it actually leaves me a question. Dr. Eric, you need young pharmacists or young students to also have some spaces provided for them in decision-making places for them to contribute. Because if they plan for us, not with us, we will not really see the changes we want to see. So what do you think, having maybe the CP or a class representative of level 2 maybe participating in the council happening of that is mainly made with lecturers and HODs and deans. What do you think? Maybe it is done. Louis said that the knowledge is power. We will also need to hear from our leaders here to tell us if it is done. Why don't we see the changes that we need? So what do you think? Just react on that.
I think it is something very important. It is not even good or recommendable to see a student from class 1 to class 5 without participating in any event of the elder sisters and brothers in the profession. It is not something good. It's like being born prematurely. So you can find yourself like Shinjiro find himself leading the council after graduation. It is something like that is not recommendable. So what we do is to culture those leadership skills. We take those people that we have seen with the capabilities of leadership, bring new change that we want, then we try to promote them from early stage of school or as they are growing up. So from those, if we can be able to see those people, then we can try to help them increase their potential so that maybe at that level, when they are reached those level, they'll be influential people that can bring those changes that we need. So it is very important to bring them on board. So Shinjiro, and those CPs, level 2, level 3, level 4, plan to attend in those events. And I call the leadership of our council also to remember these young people, to empower them so that when the times come, then they will be able to take over. So it is something bad if someone take over and then he doesn't have any connection, any background of the council, so it is something bad. Thanks.
Right. Thank you so much. Apologies if I took so long to come back to the audience and also everyone following us. And remembering that we are having this session being a hybrid, we would love also to receive the question from the people who are online. If you have any question, please kindly type it in a chat box and we just pass by there and also read the questions. So the protocol team, if you are around, first of all, I would love you to pass the microphone to the leaders in front of us to react on the topic that we are having, leadership and change management in the pharmacy profession. How do you see the leadership and what are the gaps? How do you think as young people who are gathering here today should be contributing in the decisions? Is there some spaces provided for them, yet they are not really used effectively? So what do you think? I would love to have Dr. Françoise and Dr. Nyangi reacting on the topic. Thank you.
Thank you very much for the opportunity to react on the capabilities of our young students and pharmacists in leadership positions. So for me, the leadership capabilities, our students, they have it. They have that capabilities. As I said yesterday, all what we do is to develop in you what we call soft skills, including leadership capabilities. And each and every lecturer is recommended to build that in a way or another way. We don't have a course or a module called leadership, but we encourage and we are requested, all of us, during our lecturing time to try to use any method which should build in you that skill. And I'm sure you have that. Even not, you don't have a real time to express all of you, but for example, remember when you have group work, those who had the chance to meet me in my course, you remember that the first thing I said when I gave you topics into groups is first to elect a president who will moderate the activity. You elect the secretary, and then you elect who will report your work. And this is the starting point to motivate a leadership. If you are president, you were elected by your colleagues to be president or team leader, they have to respect you, and you have to use that opportunity to exercise all capacities, all characteristics of a leader on your small team. And then this should grow. Even in your families, there are some who lead their families. They should conduct family meetings. You have those capabilities, and even here at university, we have the mandate to grow in you those skills. And you have, if Shingilo was able to organize this event with his team, you have. Of course, all of us, we can't be leaders. They are leaders by nature. I don't know. They are who had that skill which is really so expressed in them, but each and every one has some level of leadership in him. And remember that yesterday, the principal said, it is the first event we have after the 2 years COVID period among you. It means that you have, and I know that at the time, pharmacists had time to express what they are able to do. We are seeing many people leading high-level positions, and they achieve a lot. there are several examples, and you saw all speakers in front of you. They expressed they thought well, and I expect that at any leadership position they should succeed. This is what I can say. You have that skill in you, and we give you all the time opportunities to express. For example, group work is a good example that is really like innovation in education to build that skill. Thank you.
Thank you so much, Madam Professor. That was really important, and thank you for believing in us. Now let's hear from Dr. Nyange.
Thank you. It's quite difficult to speak after my HOD, but I want to compliment her, because in our daily activities at the department level or individual level, we try to leverage your leadership skills through different strategies. I myself used to mentor students, and I think some I can confess that. But also we have some meetings with colleagues in department on how to help students when they organize events like this, when they organize social activities or community work. We all stand up and support as a department family. So I think we are open to receive you whenever you want any kind of support, so that you will take over our positions.
Okay.
Thank you.
Thank you so much. I think every young person who is here, will hold them accountable. They are promising us to help. And that's true. We never seeked for our support from them, and we missed it. So we are hoping to always grow from your leadership and your mentorship. Now, only 2 questions from the audience. Yes, please, Maurice.
Thank you very much. My name is Maurice. I'm part of the former leaders of RPSA. I think 12 years or 13 years ago. First of all, thank you very much for taking RPSA to where it is today. Is it allowed?
It is allowed. It's okay.
Do we have international people who are not understanding Kinyarwanda?
I think I will summarize in English.
Yeah.
All right.
But let me try to stick to English anyway. In our days, we never had such kinds of symposiums. I think the activities we used to carry out were outreaches. But now it's moving towards more of, for example, you yourself who is seated there, you're improving your leadership skills through communication. So such platforms is already a great milestone to congratulate yourself, congratulate the department. But let me go back. I happen to be privileged to lead a big team of pharmacists, nurses, management people in the private sector. And over the years, when we came bound with university, you found that you become a managing director or a pharmacy manager, and now all of a sudden you have a team of 4 or 5 people you have to lead. You have a challenge of stakeholder management. You have MOH. You have, if you're in a pharmacy business, you have suppliers. You have your clients. So, and then now it comes back to how do you move from point A to point B, which Eric said. Now, it comes back to one thing. I say, to what extent have you mastered leading yourself? So it first starts with you. Then, and it's a process. So a leader is a continuous learner. They learn from their mistakes. They are humble enough, there's humility. They are humble enough to realize that they don't know everything and they can learn from anyone. They are self-disciplined and they have the energy, self-drive and energy to say, okay, fine, this is where I want to go as a business. I'll speak from the business perspective or as an organization. And these are the steps to get there. And you identify what the requirements that are required to say, hachenewichi kugira ngo tugere hariya. Ese in my team nihereyeho ngera ku kazi ku gihe. Simple things like that. Self-discipline. Ese nkanjye nk'umuyobozi ni nuruhe rugero mpa bagenzi banjye. Ni njyewe uri ngitabe telefoni ku kazi. Kubaha. Ibi ni ibintu batwigisha turi abana. Mwubahe abantu bakuru. Tutari ngo muri pharmacy cyangwa se igihe umuntu aje muri biro yawe niwe client wawe ni umwami. Kumbaha. Kumvira, kumwumva, be a good listener is also an attribute of a leader. So, ari ibintu bito that we, and I'll tell you one thing, be it in an office like Eric is in, be it in a business, the ability to switch off and give somebody the right attention they require, kumubaha, kumumva, practicing listening skills, practicing communication skills, ability to hone the skills to summarize what you want to communicate in very few words. Go uzazinjira mu biro bya minister ufite iminota 5 yonyine cyo kuvuga ibyo ushaka kandi urashe ku ntego. So ability to be in such platforms, I encourage you, engage, ability to go. Another aspect is self-sacrifice, having empathy. Nukuvuga ngo ese hari activity yo kujya muri kwigisha abantu kurwanya igituntu, kwigisha abantu ibijyanye na Ncds. Ese iyo wishize mu mwanya w'umuntu w'umuturage in the community utaragize chance yo kugira information hiyo ufite, what is your responsibility towards community, that you have that responsibility to share that knowledge to improve the quality of life around you. So that's empathy. Mukiyaje muri pharmacy yaraje, you have to put yourself in their shoes. Uyu muntu arababaye, I have to really give them the very best knowledge, transfer information, give them the best solutions to make sure that they live a better life. So empathy is a key thing, and these are things we learn along life. Okay, we learn every day. Self-sacrifice. Esuru muyobozi wa pharmacy baragusabye uraje, because when you get into a pharmacy business, what to say, you uzabu ushinzwe no kuyobora abantu, human resource management. Munaza gutumiki ibibazo kiri personal. How do you manage to have ability of privacy, confidentiality? How open are you? There are many things. So, in a nutshell, there is a leader. In each and everybody, there is a leader. The difference now comes in how you master different aspects of leadership. there are many different aspects of leadership. Hari one who is a visionary, hari n'undi who is a cohesive person within the team. Yabada hari muri equipe ukabona equipe ntabwo irimo gukora igomba gukora. Abareba umupira murabizi. So we can learn leadership from many things, from organizations, from businesses, from football teams, from games. So just say, be open to learning. Ubwo uri mu wa kabiri, mu wa gatatu, mu wa kane, now you are learning to manage yourself and to lead yourself to achieve the goal of finishing as a pharmacist. And even when you finish as a pharmacist, now you now start a journey of now, how do you give back to society in terms of building your country, contributing towards building your country, and also building yourself as a person. Just always remember that starts from there. But now, what the pharmacy comes to build on, there is different skills. There will be an engineer, there will be a pharmacist, but nothing can happen without management, without leadership. You have the core skills, but the ecosystem that allows things to move is management, is leadership. We can talk, there's a lot you can say about leadership. There's a lot. And I encourage you to,
Lecturer for immunology, the lecturer was appointed to RPSA management, and then I decided to for immunology, the lecturer. For pharmacists, where they should learn how immunology is applied in pharmacy. Fail the module because it's not interesting for them to follow. Thank you.
Patrick, straight to the question.
Thank you for the time with me. Let me take this opportunity to thank for RPSA coordinator team. I used like less than 1 minute as testimony for my young sister and the brothers. Mwakoze cyane ntabwo nagenda nabivuze all topic was interested muri no symposium ariko when they come to the leadership numvise ariko nababwira nanjye I joined RPSA since 2014 yabaye kuva ya kane kugeza ya 10 zose narazitabiriye. When they come to the leadership, ndibuka ko nagiye muri RPSA ndi muri subcommittee ya treasurer muri 2015 2016 nkajya nkaba 2014 nkaba treasurer wa RPSA 2016 2017 nkajya muri team yateguye nama ya WHSS. Ndi kubivuga atari kwitaka ariko ngira ngo mvuge ko bano bose bari hano ari Ange uri gupresenta, ari ba Israel, ari ba Otiniel, ari ba Jeff, ari ba Elimandera, aho bari ubu bose bagiye bakoresha opportunity baciye muri RPSA committee. Ndakeka ntago ari bo gusa abanyeshuri bize pharmacy ariko hari example nyinshi twafata nka 98% abafite position navuga z'agaciro haba mu NGO bakora haba mu public institution barimo haba muri private abo bose baciye mu buyobozi bwa RPSA. Maybe I'm not oriented cyane kuri leadership, I'm oriented for the business ariko opportunity nagize yo gucamo nkayobora RPSA nkajya muri subcommittee nkaba treasurer nkajya muri partnership manager wa WHSS nkaba financial manager wa World Congress twakiriye. Hari icyo byanyeretse, hari icyo byanyigishije. Icyo nashaka kuvuga muri rusange nuko once you get the opportunity yo kuba waba muri subcommittee waba uri muri komite koresha amahirwe ufite. Hari abacamo gutyo nyine akavuga okay ndi treasurer ndi vice president ukumva ko aho gusa nukoresha amahirwe ubonye yo kuba wagira connection wagira networking hano hanze. Ugeze hano hanze ni ubona agaciro kayamahirwe wakoresheje igihe wari uri muri ubwo buyobozi. Sinangomba ko mwese mujya muri komite, ariko nimba hari event runaka bateguye wenda screening wa mbere wo kuba motive wo kuba wayitabira bizagufasha once you come outside here uri muri profession yacu. Murakoze.
Thank you so much. Thank you so much for our leaders. We are really indebted to your leadership and your support and everyday mentorship. Sometimes it's bitter, but it is necessary for us to go through that to grow. I also thank Patrick and Maurice for sharing the experience, sharing your opinions. We really love to hear that, and it's really good for us who are still growing up. So now back to our panelists. Ange, if you could also get closer to the mic. We're going to have your conclusion, your recommendation. What do you think you should recommend to the young people who are hearing right now in regard to the topic that we were talking about? Maybe Mr. Eric, you should go first, and then Ange will go after you. Thank you.
Thank you very much. Reka njye mbabwire ikintu. Mere no kuri Etrod imbabazwa cyane nuko hari umuntu ubwira ibintu ukabona ntahari. Kamusore kubibwira abanyeshuri hano ari ku ishuri. You remember my classes, sinabivugaga izuba ryaka. Reka mbabwire nimusohoka hano hanze ntabwo muzongera kwiga molecular biology, genetics, chemistry, analytical chemistry, ya chimie, pharmaceutical. Abazahura nabyo ni 5 cyangwa 10%. Ibintu muzahura nabyo ni ibyo buzima bwa buri munsi. Communicate, humility, listening, soft skills bavuze. Ikindi, hari abantu bayobora. Ngiye ntabwo nigize mbasebe, reka mbabwire. Ntabwo nigize mbasebe mu buzima bwanjye. Ariko amategeko ya RPSA igendera mu yanditse ndimo. Kubera iki? Amushwa ko shingiro hano hari abantu agisha inama batari muri komite. Ndabeshya. Hari n'abandi bantu baza kumugira inama bamuyobya. Shingiro abeshya. Umuyobozi agomba kuba focused. N'undi muntu wari wese. Twavuze ngo buri muntu ubuyobozi buhera kuri wowe, then ukagenda ugira responsibility yo kuyobora abantu benshi. Rero iyo utaraorganize wowe wenyine ntube focused, ntabwo umenya ngo ndavahe ndajyahe. Ikintu cyose kije kiragutwara ugata focus. Si ngombwa ngo ube managing director w'ikintu gikomeye. Buriya kugira ngo uzagire aho hantu, wa muntu uzagushaka kugukira aho hantu azabanza arebe ngo wa muntu ugiye gushira from hahandi yitwaye ate. Yari umuntu uri focused, yari umuntu uri serious, yari umuntu umeze gute. Ibyo byose bazabireba kugira ngo bakugire icyo cyizere cyo kuvana ngo ujya ahandi. Ikindi, abanyarwanda tugira ibintu byitwa ngo siniteranye. Show your position. Niba ikintu utacyemera kivuge. Icyo kintu hari igihe bizaba ko gishingirwaho uhabwa izindi nshingano. Sinzi niba mu by'ubu ndi kuvuga. Buriya hagati ntabwo habaho. Ngiye niko nemera. Icyo ni ikintu. Hanyuma ibindi byose ni ibintu biza buhoro ariko utataye focus, ukaba disciplined. Ibindi byose ukoze cyane biraza. Murakoze.
Thank you so much. Thank you. Ange, if you could hear us, please, if you can unmute yourself and give your recommendation to everyone who is hearing now.
Thank you, Ange. Nakunze cyane ibyo abagiye bavuga bagiye bakomezaho cyane. ku rugendo twatangiyemo turi mu mashuri kugeza n'ubu ngubu kuko ibyo twabonye ku ba lecturers bacu ku barimu bacu nibyo bitugejeje aho turi ubu ngubu hiyongereyeho n'ibyo twagiye duhura nabyo mu buzima busanzwe. I would, first of all, before saying a take-home message, I would first of all like to congratulate Dr. Françoise. She's one of the few women that we have who have been able to pursue her studies until she got her PhD. She really inspired many girls who are into pharmacy profession and women who are pharmacy students. That was very tough, which was good because byatumye natwe tubona ko ubuzima hanze iyo uvuye mu ishuri you have to be tough and also you have to fight to provide all your efforts to be able to get what you want. It's really good and just congratulations, Dr. Françoise. I thank you so much for your leading example, for being a role model to many women and girls. Ikindi navuga wenda as a take-home message, thank you. Ikindi navuga as a take-home message, nuko tutagomba kwitinya as pharmacy students. Kutitinya buriya nicyo kintu cyambere. Ushobora kuba muri ino symposium uri gukora protocol. Ejo ukajya gusaba ahantu akazi bakagukoresha cyangwa bakakubaza ngo tubwire nibura any leadership role that you have taken that can help you to hire you. Wivuga ngo nabaye protocol ngo kuba protocol ubwabyo means ni ukuyobora abantu aho bajya kwicara. Ubwabyo that means a lot. Kuba warakoze ibijyanye na funds mobilization, wiruka muri pharmacy, wiruka muri NGOs, wiruka mu bigo bitandukanye ushakisha funds for you to host such a big event. Nabyo it's a leadership role. On your CV should write, I was engaged into funds mobilization for the organization of this symposium. I contributed to the development of the program. Let's say anyone who's a program now. I contributed to maybe ushatisha speakers, that's something that is really, really big that you should not take for granted. Kuko ntabwo ari buri wese wakoze protocol, ntabwo ari buri wese woganije inama, ntabwo ari buri wese wakoze ibya funds mobilization, ntabwo ari buri wese wakoze kuri program y'inama. That means you have something in you that you should nurture, that you should pursue, that you should, strengthen. Already you have that leadership skill in you. Now, how can you develop that leadership skills? It's through networking, it's through getting informed, just try to seek as many information as possible. It's through determination, and it's through discipline. Being a more yourself is that you should have discipline. Without a discipline, you cannot be a good leader. You can be a leader, a bad leader, or be a leader who's with discipline, you can become a good leader. So let's all fight towards becoming good leaders. Kandi nanone niba uri leader uyu munsi uri mu kazi, fasha wa wundi uri mu ishuri nawe kugera aho ugeze. Morris, guide as many young people as possible. Help them, mentor them. I will learn something about Dr. Nyanri. I'm glad that he's already there attending this symposium. He has always been there for RPSA. Ikintu cyose bashaka bamugisha inama. He was always there for us as students at that time. I'm also happy for him that he has now, that he got his PhD. Kwa kundi yatajya tugaidinga nawe mudashyira muri ikintu cy'Imana nawe Imana yaramufashije agera kuri cyane. So we wish him all the best also. Kandi nawe akomeze kumentoringa yabaho yabana Dr. Françoise. Please keep mentoring pharmacy students from your leadership example, from your efforts, from your strength, from everything that you have as good as you can share with them. They will become good leaders. Thank you.
Thank you so much. That was really interactive, and I love how everyone was willing to contribute and participate. So,
can I answer?
Of course.
Reka mbabwire ikintu kimwe. Ibintu byose bihera muri ministeri niba turi muri health sector. ntabwo twavuga muri perezidansi cyangwa muri primature bihabwa minisiteri. Abo bantu mwigana navuze ngo ni abaganga, mushobora kuba mutabizi neza nakoresha indimi z'amahanga. Bariya abaganga mu making sure ko mukoranye nayo ibintu byose byiza, kubera ko kugeza uno munsi umuminisitiri tumaze kugira umufarumasiyen ni umwe, n'amahirwe yuko tuzajya kugira undi mufarumasiyen ari hasi byo dukurikije ibyatambutse. Kugira ngo tugire iyo myanya bidufashe gupromotinga profession yacu, byagenda gute? Byagenda ko twaherara ku ishuri dukorana nabo, kubera ko bo already bizwi ko ari bo bari likely kubona iyo myanya, tubaye twarazamukiye aho hamwe. Nibyo byonyine byaduha amahirwe yo kugira muri iyo myanya tukabona uko dupromotinga umwuga wacu. Sinzi niba none byumvikana cyangwa muri mu kubiha imbaraga njye byumva, ariko please try your best. Izo nama zabo muzitabire, muba challenge, mu contributing, niba ari bya bindi yanje yavuga bifite akamaro, niba protocol volunteer, niba ari program designing volunteer, show up yourself. Sibyo? Then icyo gihe maybe bizaza. Murakoze.
Murakoze cyane. Without taking much of your time, now I would like to give the mic back to the moderator, the MC of the session. Thank you.
Thank you very much. We thank all the speakers and the participants together. This was very inspiring. Please, you can go back into your seat. And they reminded me one thing, that the biggest sin is not killing people, is not lying to people. The biggest sin is not using the potential that God has given you. So use your potential, build the confidence, and build the leadership spirit in you. So without taking a long time, I would like to ask you to a very big clap to them again as they are sitting. As you know, we have limited time and we still have 2 panels. That's why I'm asking you go for the lunch, but please use not more than maximum use 40 minutes so that we can come back and learn about sexual and reproductive health services. Please, you are welcome on the table.
Ushers, you can guide our lecturers to the table. Ushers, please.